Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth Ichila, Coffee's Hidden Heart Risks Revealed, and trust me, it's juicier than your cousin's peach cobbler. You drink coffee every day, but is your morning habit secretly damaging your heart? I see patients all the time who think they're doing everything right for their cardiovascular health, then I find out they're mainlining caffeine like it's going out of style. Today we're going to discover the surprising truth about caffeine and your ticker, and I guarantee you'll learn something that'll make you look at your coffee mug a little differently. Now, before you start pouring your beloved Java down the drain, let me tell you about what I call the caffeine sweet spot. Most adults can safely consume about 400 milligrams of caffeine daily. That's roughly 4 cups of regular coffee. And here's the kicker, this amount can actually benefit your heart health by improving blood flow and circulation. Yep, entirely true. I can't make this stuff up. Think of caffeine like seasoning on your food. A little bit enhances everything, but dump too much salt on your eggs and you've ruined breakfast. The problems start rolling in when you exceed 600 milligrams daily. That's when your heart starts throwing a tantrum with palpitations, elevated blood pressure, and that jittery feeling like you're a chihuahua on a sugar high. Your body weight and individual sensitivity matter way more than these generic guidelines, too. A 120-pound person and a 250-pound linebacker are going to handle caffeine very differently. But here's what most people don't realize, and this is where it gets interesting. Your morning coffee isn't the only culprit sneaking caffeine into your system. Energy drinks are like caffeine grenades, packing anywhere from 80 to 300 milligrams per serving. Then you've got chocolate, tea, some over-the-counter medications, and don't even get me started on pre-workout supplements. Some of those bad boys pack 200 to 400 milligrams in just one scoop. That's like drinking 4 cups of coffee before you even hit the gym. Most people underestimate their actual caffeine intake by about 50%. They'll tell me they only have 2 cups of coffee, completely forgetting about the energy drink at lunch, the chocolate bar at 3 p.m., and the pre-workout shake. It's like financial budgeting. You think you're spending $50 a week on coffee, then you check your bank statement and wonder where that extra 100 went. Let me share what happened to one of my patients, and maybe you'll see yourself in this story. Sarah, a 35-year-old teacher, came to me complaining of chest palpitations and anxiety that was making her feel like her heart was doing the cha-cha in her chest. Sweet lady, but she was convinced something was seriously wrong with her heart. So I started digging into her daily routine. She drank 2 large coffees every morning. That's about 200 milligrams right there. Then she'd grab an energy drink around 2 p.m. to fight the afternoon crash, another 160 milligrams. After work, she'd hit the gym with a pre-workout supplement that packed 300 milligrams. Sarah wasn't just exceeding the safe limit, she was lapping it. Her daily intake was around 750 milligrams, nearly double what her heart could handle comfortably. Within 2 weeks of cutting back to about 300 milligrams daily, her symptoms completely disappeared. No more chest flutters, no more feeling like she'd stuck her finger in an electrical socket. As I always tell my patients, timing matters as much as quantity when it comes to caffeine and heart health. So what should you do starting today? First, stop all caffeine intake at least 6 hours before bedtime. Poor sleep damages your heart health more than moderate caffeine could ever help it. Your heart does its best repair work while you're snoozing, so don't mess with that process. Second, spread your intake throughout the day rather than consuming it all at once. Don't be the person who drinks 6 cups of coffee before 10 a.m. and then wonders why they feel like a hummingbird. And please, listen to your body. If you're getting jitters, rapid heartbeat, or feeling anxious, your cardiovascular system is waving a red flag at you. Here's your action step, and I want you to actually do this. Track your total caffeine intake for 3 days using a phone app or just write it down. Be honest about everything, the coffee, the chocolate, the energy drinks, all of it. If you discover you're over 400 milligrams daily, reduce by about 100 milligrams every few days to avoid withdrawal headaches. If you're consistently hitting 600 or 700 milligrams, maybe I should see you in the clinic. We need to talk. Your heart will thank you, and you might be surprised how much better you feel when you're not constantly overstimulated. Remember, we're going for sustainable energy, not the caffeine roller coaster. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.